Kenya pharmaceutical industry has struggled to narrow the medical supply chain to make medicine more affordable and accessible. In a bid to bridge the gaps between medical providers and consumers, Irish private equity firm ION has invested $5 million to launch a mobile-based app dubbed MyDawa. Tony Woods is the managing director at ION Kenya, joins us now for a look at this and a lot more. Tony, glad to have you speaking to us. Now, this particular platform that we're talking about is the first of its kind. So obviously the issue with such a product is the feasibility studies on ground to measure its possibility of success and why it wasn't ventured into before, knowing very well that Kenya is actually one of the most innovative on the continent. So help us understand this.
Okay, thank you very much, and good afternoon. Yeah, you made a very great point there. Kenya is one of the most innovative markets on the continent, which is really why we chose Kenya. And what we want to do is use technology to help us meet some of the challenges that patients and consumers in general are having. And what we wanted to do was provide a range of pharmaceutical and wellness products. So MyDawa is both a pharmaceutical and wellness product brand and also a technology solution to make those products much more affordable in the Kenyan market, make sure that they're of a guaranteed quality, and make sure that there's a level of convenience and privacy in the way that they're dispensed to the patient or the consumer, and make that simple so it can all be accessed from a mobile phone or from the web, and uniquely, we think, globally, is an authentication mechanism that allows the consumers to be confident in the genuineness of the product that they're purchasing from us.
All right, let's get into the specificities of the healthcare products. There's been concern that when people are buying off the shelves, they're not so keen on the potential for abuse, at least for those making money off of it, or there's the misuse that could now lead to antibiotic resistance and a lot more rippling into the health sector. Help us understand how you're working out these kinks.
Yeah, I mean, that's a real problem sometimes, not just in this part of the world, but globally. Resistance to antibiotics is something that's growing significantly. So we will not dispense any prescription-only medications without a valid prescription. And that prescription can be obtained from your healthcare provider. It can then be uploaded directly onto our app. And it's a very, very simple process. And there, our fully qualified pharmaceutical team will then transcribe that prescription and place it into your basket. Thereafter, the checkout is very much like any normal or any other e-commerce site, but also with the added option where you can select a pharmacy of your choice for your product to be delivered. So we'll deliver it to a pharmacy, whether it's close to your place of work, whether it's close to your home. So there's that element of convenience in being able to pick up that product when it makes sense for you in terms of your busy schedules.
Right, now, you mentioned that you've committed an initial 500 million shillings, that's about $5 million, to the business, but the key word is initial. So we're anticipating that MyDawa will develop into something, but we're not sure what. You'll help us understand and how much this would set you back moving forward.
Okay, yes, I mean, $5 million has been committed already, and that's helped us through the development phase. Whilst we launched at the end of last month, this has been at least 18 months in the development. So that $5 million has covered that development phase. It's covering the procurement of our products, and also will manage the business through to the end of this year quite comfortably. Obviously, as we go through this year, we'll expand across Kenya. We're starting initially in Nairobi, but we'll expand across Kenya throughout the year. And then as we go into 2018, we'll look to see how we can expand regionally. That's certainly an objective for us. This isn't just a solution for Kenya. This is a solution for sub-Saharan Africa and to be honest, beyond that. So during the course of 2017, there will be discussions on further funding rounds to support that much wider expansion.
Oh, no, I'm happy that you brought up the issue on regional expansion. There's one such platform here in Rwanda where I'm from. It's called Babel, that brings together professional doctors and nurses into a booth where you can have live conversations with the patients from whichever part of the country you're in. Is this a possibility of some of the expansion plans that you could be getting into? And if you do get into that, I'm demanding my royalties on the same.
Well, it's very good that you mentioned that. There are a number of different applications now for access to prescribers where they can go through that whole consultation process. And for us, we see ourselves as being very much aligned with those. We're certainly not overlapping, but there's a great synergy between those that do the prescribers, such as the one that you've got in Rwanda, and ourselves. So we are certainly in conversations with a number of such platforms to explore how we can work better together. So when somebody comes to us, we can refer them to them to ensure that they've had a proper consultation and a prescription, and also vice versa, where someone's had a consultation with those, then they can be assured of quality products where you can guarantee the source coming back through MyDawa.
Now, locally, 75% of Kenyans do not have insurance cover. This presents a huge barrier, a huge loophole for your business, doesn't it?
Yeah, and that's the thing. So there's a number of people who don't have insurance, and the fact that we have affordable products helps us with them. And again, through partnerships, we'll look to see on ways with microfinance where we can make those products accessible, and that's very much where we're focused. And also the conversations with insurance companies, we've already started those. I think we have a great solution for insurance companies because of the transparency of our technical solution. It means that we can link with insurance companies, and some of their back-end costs, especially around fraud prevention and fraud investigation, can disappear or be significantly reduced through working with us.
Now, you've talked about synergy with private players both in Kenya and across the region, but how is the government actually receiving this application? Are we hopeful, or do we anticipate that it could come as competition at some point? What are the conversations happening on ground?
Well, I think the solution that we've got is very synergistic to an awful lot of players that are there already. So we're not looking to tread on anyone's toes. But the support that we've had from the government has been fantastic. We've really tried to be very inclusive in the way that we've gone about the development. So we've had many back and forth conversations to make sure that what we're doing is really addressing a problem that's there today. We've worked with the Ministry of Health here in Kenya. We've worked with the regulator very closely, both to ensure that our solution falls within the regulatory boundaries, but also to get our own products registered. That's by its very nature quite a timely exercise, a time-consuming exercise. I mean, we don't want these kind of pharmaceutical products to be rushed through. So we work very closely with the regulator to make sure that there's a comprehensive review done of all our products.
All right, now finally I have to ask, we've covered the issue that you might have, misdiagnosis, issues on the framework, scalability. What other issues are you handling that might be a big challenge for you moving forward?
Well, I think one of the issues that we cover is the convenience. At the moment, there are many examples of people not being able to find necessarily the product that they were looking for, having to find themselves go around a number of different pharmacies before they can find the correct product. With us, we aim to eliminate that, and by making sure that we hold the products available, and then people can upload their prescriptions and get those directly from us. We also have a much wider range of wellness products and health and hygiene products, again, which we will provide the same solution, and we will deliver those with privacy. So we address the whole privacy issue. Sometimes people can be very embarrassed going into a pharmacy and asking for specific products. We can take that element away by the privacy solution that we adopt around everything. Everything that gets delivered to a pharmacy for a particular patient is in a sealed package. So I think we address a number of patient concerns and patient issues that we've picked up from research that's been done over a considerable period of time.
All right, I really do appreciate you creating the time to give us that insight. Tony Wood is the Managing Director of ION Kenya. They've just launched a mobile-based app dubbed MyDAO. Many thanks for that.